All right, so one of my favorite topics is, can childhood trauma resurface later on in life? 100%. Because let me explain why. So, with trauma comes avoidance. So, when you're very young in life and you've had abusive parents, neglectful parents, my definition of trauma will go to 85 terms because there's so many ways to which you could traumatize a kid. And in doing so, when you're traumatized, you're developing your personality. This affects your attachment style, your friendships, your trust, your ability to think you could perform better in life. And will it affect you later? Of course, because as you get to be older and develop friendships and relationships, it will definitely affect the way you see your partner. And there are conditions like borderline personality disorder, narcissistic personality disorder. The beneficial one out of trauma is a person called an empath, avoidant personality disorder, many. But what it comes down to is a fundamental principle of adults. They need good attachment to avoid trauma. So most people in this society have avoidant anxious attachment. So they'll be clinging to someone and then avoidant because of trust, of how they grew up, and it'll show up 100% later on. You see it in relationships with domestic violence or abuse or neglect or being with the wrong partner. And ironically, you'll tell people, well, why are you with this person? Sometimes they don't even know because it's so deeply ingrained in their subconscious that it's almost normal. And I could understand why, because there's many layers of a human being that lie far beyond medicine. You need to affect part of the brain chemically, but a lot of it lies deeper in subconscious. Half the time my patients that I talk to, because I do a lot of psychotherapy far beyond medicine, which is very important, don't even understand the connections, how their mother relate to their husband or wife, because these patterns are laid deep within our life. And so 100% will it come up later on until you get awareness and empower yourself to see these patterns. And most people have a hard time because avoidance is key in survival. So if I avoid thinking about trauma, I think it'll go away. It's a total misnomer. And that's where therapy is key.